A new study reveals nearly 140,000 nurses have left the workforce since 2022. Even though we are 5 years past the pandemic, the medical field is still feeling the effects from the pandemic. Through the survey, they found the nearly 140,000 people that left, that was because of workload, understaffing, inadequate salary, workplace violence, and stress and burnouts. These were not people at retirement age. The concern now is that more people will leave the job.
The issues that I think emerge out of our survey also speak to the need to retain the current workforce.
This survey was completed by 800,000 nurses from coast to coast. They come from a variety of backgrounds in the field. The survey was published by the NCSBN, a regulatory organization. That's where Brendan Martin is the director of research.
I think where we would get ourselves into trouble is not necessarily training enough nurses to enter the workforce, but in retaining those nurses that we have trained, that we know are capable of high quality care and that will ensure patient safety moving forward.
The retention aspect is something Martin says will be crucial for the field. According to the results, 40% of people say they plan to leave the profession by 2029. That's about 1.6 million nurses.
Now is the time to try to put in place those policies and those strategies to make sure that we head off any shortfall in supply when we know the demand for healthcare is really only inevitably going in one direction moving forward.
The results weren't all bad. Martin says it shows recovery in this field after the pandemic. However, they found much of that recovery is credited to people returning to the workforce.
We saw in the past 2 years is that many older experienced nurses kind of came back off the sidelines and re-entered the profession, kind of bringing the numbers up.
The survey has been published every 2 years since 2013. Martin says there are thousands of new nurses that enter the field every year. Right now, it's about keeping them.
Many of these issues long predated the pandemic, issues of short staffing and high workloads. But evidence from our own survey, evidence from other surveys suggests that it was greatly exacerbated by the pandemic.
Based on the results, workloads have decreased for some who were surveyed and staffing issues have subsided. But there's still the concern of burnout among people in the fields.